She was in her 40s and on multiple blood pressure medications, but she still could not get her numbers under control. When I told her that we had finally found the cause of her high blood pressure, she was shocked because no one had told her that sometimes high blood pressure isn't just high blood pressure. If you're young and you're on multiple blood pressure medications, or if you've ever wondered whether or not there's something deeper driving your high blood pressure, you are going to be so glad you clicked on this video. Most people are taught that high blood pressure is aging, genetics, salt, or stress. And most of the time, that is true. But sometimes treating the number without looking for the cause can lead to years of frustration. I'm going to share with you the story of one of my patients whose high blood pressure was not run-of-the-mill high blood pressure. Her treatment looked radically different than traditional treatment for high blood pressure. When I first met her, I could feel her confusion and frustration immediately. In her 30s, she had been told that her blood pressure was borderline. Pretty soon, medication was recommended. This felt very wrong to her. No one that she knew was on blood pressure medications, and she just felt that she was too young. So she did what any thoughtful, committed patient would do. She tried some lifestyle changes. She cut back on her alcohol, she reduced her stress, she started exercising regularly, and she cleaned up her diet. She wasn't perfect, but she was committed. When she returned for her follow-up and her blood pressure numbers had not budged, medication was recommended again. She was hesitant to start medications, and she actually wondered whether or not she has something called the white coat effect. And that is when someone's blood pressure is consistently high at the doctor's office, but it's actually normal at home. So she bought a home blood pressure cuff and she measured her blood pressure for 2 weeks diligently. This is such a wonderful strategy that I recommend it to most of my patients. And it's because we want to verify whether or not that blood pressure is accurate. We want to be working with the right numbers before jumping into treatment. But even at home, her blood pressure was consistently above 140/90. And very reluctantly, she agreed to take medications. She was put on a medication and this did work, but eventually it stopped working. She was then put on a second medication and she had a bad reaction to it. So then she tried another medication and it worked again. Same story, it stopped working. She was then put on a third medication. That's when she came to see me because she knew that something wasn't right. We slowed down everything and we went back to the very beginning. One detail jumped out immediately. She told me that her partner had caught her snoring loudly on multiple occasions. She also mentioned that she falls asleep very easily when watching TV in the afternoon. This is a huge clue for obstructive sleep apnea. This is a very under-recognized condition that can drive up the blood pressure. When I also reviewed her labs, I saw that her potassium was consistently on the low end of normal or low for many, many years. This is another clue for a hormone issue in which the adrenal glands produce excess amounts of aldosterone, which can quietly raise up blood pressure and quietly lower potassium in the background. When I shared this with her, I saw that something shifted. For the first time, her story started to make sense. I sent her to an endocrinologist and a sleep specialist. Eventually, she got surgery for her adrenal gland and she had her sleep apnea treated. When we started treating the cause of her high blood pressure, instead of stacking medications, something remarkable happened. We were able to stop all of her blood pressure medications because her blood pressure had normalized. I am sharing this story because the treatment of high blood pressure can be very frustrating. It is a very common situation. About 1 in 10 people have something called secondary hypertension, in which there is a known cause that is driving up the blood pressure. And the treatment approach is completely different than the typical treatments for high blood pressure. This is not about demanding more testing or not trusting your doctor. Most of the time, high blood pressure is very multifactorial and there is not a single fix. But sometimes the most powerful thing that you can do is ask better questions. So here are 3 questions that you can use to open up a conversation with your doctor about secondary causes of high blood pressure. Number 1, is sleep apnea something that could be driving my blood pressure? Number 2, is my potassium or my response to medication suggestive of secondary causes of high blood pressure? Number 3, do you think that there are secondary causes of high blood pressure going on here? This is how you advocate for yourself without creating antagonism or increasing the tension. I think the biggest takeaway from the story is that sometimes blood pressure isn't just a number, there's some underlying cause of it. So if someone you know is struggling with getting their blood pressure under control, make sure you show them this video. And speaking of blood pressure numbers, we don't want to jump into treatment without getting the most accurate numbers. The best way to do this is to actually check your blood pressure at home. Most people don't know what it takes and what to avoid to get the most accurate blood pressure numbers. So I actually made an entire video about that, so you can check it out here, and I'll see you on the next one.